This is the video competency for MA 130 patient positioning, okay? So the first thing on your competency, as always, is to go to the other room and wash your hands and assemble your equipment. So you will go to the other room when you do this competency and you will wash your hands, do a hand wash, and then assembling your equipment is grabbing your patient's chart, making sure that you have drapes available in your room, okay? Step 2 then is to identify your patient and explain your procedure. So as always, we are going to identify our patient by asking them their date of birth, okay? And then we'll tell the patient kind of what we're doing. And in this case, we're going to position them for a procedure for the provider. Now, in real life, you'd put a patient in one position and then dismiss them. Here, I'm going to put the patient in all, 6, 7, 8 positions that you have listed on your comp sheet. And this is what it's gonna look like when you comp out, okay? So you do need to know the different positions, how your drape should be, how the patient should be positioned for the test, but for the comp, we're just gonna go from position to position to position. Again, in real life, you would typically do one position, it's kind of a one and done, okay? So I'm gonna go ahead and get started by calling my patient. Step 3 is assisting the patient on the table. I'm gonna kind of do steps 2 and 3 together because it just makes sense to do that, okay? All right, so I'm gonna come out. Emily? Hello. Hi. All right, Emily, I'm gonna have you have a seat up on the table for me if you would. Thank you. Emily, can you give me your date of birth, please?
7/22/99.
All right, perfect. That's what I have here. So today, Emily, the doctor wants us to get you in position for your procedure, okay? Do you have any questions before we start?
Don't think so.
Okay, I'm just gonna kind of give you direction, and I'm gonna get you as comfortable as possible for the provider to do your procedure today, okay? All right, so first thing that we're gonna do, Emily, is I'm gonna have you undress. So now your patient doesn't have to really undress. You're just gonna tell them undress, and we're going to open up a drape for them to cover themselves, okay? There you go, Emily. Hold that right there. All right, so the first position on our list is supine. So supine is where the patient is lying flat on their back with their legs extended. So it's real important the details that you give your patient, because your patient doesn't know what supine is, and you're not gonna go to your patient and say, I'm gonna put you in supine position. You're just gonna do it because you know as medical assistant that that is the position needed for this procedure, all right? All right, Emily, so what I want you to do for me is to just go ahead and lie back, if you will. There you go, perfect. I kind of call this move my lazy boy recliner move, if you will. It's uncomfortable if I have my patient sitting up and I pull those legs out and she's sitting straight up. And it's also uncomfortable for her to lay back and then have to elevate her legs afterward. So let me just show you real quick. And I call it lazy boy because it's like when you push back on the lazy boy recliner, that leg rest kind of pops up all at one time. So it's a fluid motion, okay? All right, Emily, you want to go ahead and sit up for me? So see, as she's sitting up, those legs go down. So let me show you how it's uncomfortable. So if I go, okay, we're gonna lay back, and I have to pull her legs out, this is not real comfortable sitting with your legs out like that, right? And then the opposite, like I said, this is what not to do. Go ahead and lay back. So not real comfortable getting into that position, and now she's gotta use those core muscles, those abs, if she has any, to pull her legs up in order for us to get her ultimately into that supine position, okay? So once again, go ahead and sit up. As she's sitting up, I push the leg rest in. Again, like a lazy boy recliner, okay? So back to the beginning, I need to put my patient in supine position. All right, Emily, I'm gonna have you go ahead and lie back for me. Oh, good, is that comfortable for you?
Yep.
Now, the drape for supine should be in rectangle shape. So it should cover from the chest area to the legs as much as we possibly can, okay? Again, in the lecture portion has what supine is all used for, so I'm not gonna review that here. So the next position so when you do your comp, I'll tell you, Dana, put your patient in supine. You'll do just what I did without all the no-nos. And then you'll just wait until I give you your next position to transition your patient into. Okay, so I would wait. So now I've been told to put my patient in dorsal recumbent, okay? So for dorsal recumbent, you wanna go from a supine position and you wanna kind of, again, tell your patient what's going on. Emily, what I'm gonna do is I'm gonna take this leg and I'm gonna put this foot on the table up here, okay? So we're gonna bend your knee, foot up, perfect. And same thing on this side. Go ahead and bend that knee and foot flat on the table. So dorsal recumbent is where the feet are flat on the table, knees are bent, and shoulder width apart, okay? My drape for this is I'm gonna rotate it and I wanna make sure I keep my patient covered. I'm gonna rotate it to a diamond shape. Up here at the top, I might fold that little corner down so it doesn't cover up their face. And the reason we do a diamond shape here is so that her hips are covered. That's the widest part. That's these two corners of the diamond, right? So here, where the doctor's gonna have to do their business, is just a little flap. So that's all I have to lift up is just this little corner, this triangle of a flap, so I can access the patient's body part by keeping them as covered as possible, okay? If I had it in rectangle, I'd have to pull this whole thing up in order to access my patient, the body part that we're working at for dorsal recumbent. So again, feet flat on the table, knees kind of fall and shoulder width apart, drape in diamond. So I would put my patient like this, and I would wait until the next position given for the comp. So the next position that we're going to do is going to be lithotomy. So lithotomy, again, is mostly for pap smears. Oh, I totally forgot. This should be pushed in for dorsal recumbent, because obviously the doctor can't kind of get in there if that leg rest is out, okay? So this is my final step for dorsal recumbent. So next is lithotomy. For lithotomy, what I'm gonna do is I'm gonna pull out the stirrups, and I'm going to adjust them, not straight out, but at an angle, okay? And I have to kind of estimate my patient's height. If Emily was real tall, I'd have them way out here. But if Emily was real short, her legs aren't gonna reach these stirrups at all. So I'm gonna kind of estimate my patient's height, okay? Something that I think is kind of good. And then if she goes to put her feet out, let me show you. Like, so right now these fit, but for some people, they may not fit. So what you're gonna do is have them scoot down the table, just one scooch, and then assist their foot into the stirrup, okay? So I'm just gonna go ahead and do that. Emily, scooch down the table if you can. All right, perfect. She had her knees bent pretty well for me to start with, so it wasn't a problem. I'm gonna assist that foot firmly into the stirrup so the patient feels like they have some stability. And then I'm gonna assist the other foot into the other stirrup. And now, Emily, what I need you to do, here's a hand, if you need help, is I want you to scoot down the table until your bottom is at the end of the table. So scooch down, there you go. Like I said, if you don't need help, that's fine, but scooch down. Okay, all right, you're good. Yeah, your hips are good. So again, in this position, we have the drape in diamond shape. Not the most comfortable position to be in, but this again is most commonly how your doctor is gonna do the pap smear. If it's an older patient or it's a catheter, the previous one, the dorsal recumbent, again, that's all in the lecture. So diamond shape, feet in the stirrup, so everything looks good. So to get the patient out of this, what I typically will tell them is to push off just a little bit with their feet in the stirrups. Now you have to be careful because if you have a heavier patient, this end of the table has all the weight. So you want to kind of make sure the top end of the table doesn't pop up, okay? And then put them in dorsal recumbent and then back to a seated position. All right, Emily, you can go ahead and push back just a little bit to get your bottom back on the table. All right, very good. Now we'll go ahead and put your legs, perfect. And I'm gonna get rid of these stirrups now, just get them out of the way so my patient doesn't get caught up on them or injure themselves, okay? So now she's back in dorsal recumbent. The next position we're gonna put our patient in is gonna be Fowler. So we're gonna start with semi-Fowler. So I need to get her back to a seated position to start with. I could have her just put her feet down, but again, then she needs that core, and I wanna do my lazy boy recliner move, right? So Emily, we're gonna have you go ahead and straighten your legs. So again, now she's back in supine, and I wanna get her to a seated position. Emily, you wanna grab my hand so you can sit up, and then go ahead and sit up. Again, there's that lazy boy recliner type of move. She's sitting up nice and tall. So what I want to do next is with semi-Fowlers, I'm going to raise the back of the table to a 45-degree angle, okay? So you don't ever want to raise or lower the table while the patient has pressure on the table. So 45-degree angle, and Emily, you can go ahead and lie back. So again, my lazy boy recliner move. Nice and comfy. This is usually the position everybody likes and wants to stay in, okay? So semi-reclined in the back at a 45-degree angle, legs extended, drape in a rectangle shape, okay? So that is semi-Fowlers. We're gonna go to high Fowlers next, which is similar, but the back of the table is gonna be all the way up at a 90-degree angle. So I can't move the back of my table with my patient on it. So Emily, you wanna sit up for me again if you would? Thank you very much. And I'm gonna take the back of my table all the way straight up. All right, Emily, if you wanna go ahead and lean back now. And this one, there's not much of a pushback, not quite as comfortable as semi-Fowlers, but this is high Fowlers for our patient. Again, rectangle drape, legs extended, back to support the patient, okay? So next we're gonna go to prone. Prone is laying on the belly. So what I wanna do is have my patient, if you'll lean forward for me, Emily, thank you. I'm gonna go ahead, my table's broken on that side, so I gotta go to this side, put the back down, and I wanna put it all the way flat, because my patient's gonna be laying on their belly. So the first thing I'm gonna do is put them in supine and then have them roll over. So Emily, if you'll lay back down again. Thank you. We'll keep this rectangle because we're kind of pretending she may be undressed, right? So now she's in supine. So when you have a patient roll onto their belly or from their belly to their back, they should always roll towards you. So if I say roll towards me, she may not quite understand what I mean. Patients have anxiety when they're having procedures done, etc. So I need to give her good, clear instructions. So Emily, what I want you to do is take this shoulder and bring it towards me and roll onto your belly, okay? So bring the shoulder towards me. See, this way, if she rolls and falls off the table, my body is here to catch her. If she rolls away from me and she starts to fall off the table, I cannot save her, okay? So always have the patient roll towards you. All right, Emily, your head to the side, and then you can do one of two things. You can keep your arms to your side, or you can go ahead and bring your arms up by your head. That might be more comfortable for you. So this position is prone. Prone is just laying on the belly, making the patient as comfortable as possible, okay? The last position that we need to transition our patient into is something called Sims. Sims is the patient lying on their left side with their legs bent in a different order. So for Sims, I want to have something to kind of support between the legs. So I'm going to come around to this side, and I'm going to tell Emily, all right, Emily, what I want you to do is keep this left arm behind you, and I want you to roll up onto your left hip so you're laying on your side, all right? So can you do that for me? Keep this arm back here, back behind you. Roll up all the way onto that hip. It's not a comfortable position, I'll tell you that. And down here, what I'm going to do is put some support here. I want your bottom leg bent slightly and your top leg bent sharply, okay? And so this is going to kind of support in between. And yep, perfect. Your arm's right up there. So straighten out this leg just a little bit more. Hips forward just a little bit. This leg back. There we go. We got a little support. So this is Sims. Again, not a very comfortable position. So you want to kind of stay close to your patient because they're on their side. We would use this for like enemas or rectal procedures. So again, not a comfortable position to be in. Some people get in this position, they're like, this is how I sleep. I think it's totally comfortable. But for most people, it's not the best, okay? So now I'm going to take her out of Sims and dismiss her because we've done all the positions. I'll take this away from you, Emily. Thank you. So Emily, what I want you to do is go ahead and take this shoulder and bring it towards me and roll onto your back. So you see how I'm having the patient roll towards me? I'm keeping the patient covered. One thing I did forget, in Sims, the drape should be in diamond again. So again, we only have that little corner, that little rectangle to access the bottom area, the rectal area, if that's what we're doing. So I forgot about that, so you don't forget. So now we have our patient back in our supine position. We're ready to dismiss them because we've gone through all of our positions. Again, a reminder, you're only going to do one of these and then dismiss your patient typically. For the competency checkoff for me in my class, we're going to go through this rotation. The other thing is you may not get them in this order. I showed them, I demonstrated them in this order just because that's the order they are on your competency sheet, but I'm going to mix them up for your competency. So when you practice in different positions, and you can practice this at home with a family member, except for lithotomy. All right, Emily, we're all done, so if you want to go ahead and sit up. Perfect, assist my patient up, the lazy boy recliner. All right, are you feeling okay?
Yep.
Very important, my patient has been laying for a long time, twisting and turning. When they come up, her blood pressure could drop, and that's called like an orthostatic blood pressure. So I want to make sure, give her a sack, and make sure she's not dizzy before I leave the room or dismiss her. okay? So you still feeling okay?
Yep.
Okay, great. You can go ahead and get dressed and you can come out when you're done, okay? So those are the directions I want you to give your patient. Your patient can go. And then you as an MA, that we're just gonna play it right like that, you can go ahead and get dressed and leave when you're done. Because we aren't really getting dressed, the patient can go ahead and go, and then you as the MA, you're gonna clean your table like you normally do, okay? So if you have any questions about this video, just ask in class. We're gonna practice in class, but this is something where you can easily practice most of these positions at home on family members, okay?